Hello there, welcome to your first diabetic eye screening appointment. Now before we pop any drops in, I need to ask you a few questions from the record here. So when were you diagnosed diabetic, please? And type 2, I assume. How do you manage your diabetes? Tablets and diet. Do you know the name of the tablet you take for your diabetes, please? Just metformin. Okay, and what dose is that, please? Is your blood sugar well controlled at the moment? Excellent. What was your last HbA1c reading, if you know? Excellent. Do you check this yourself at home? How often do you check? And after meals, right? Okay, do you suffer with any eye conditions? Have you been diagnosed with anything? Have you ever been to the eye hospital for anything? And when was that? And what was it for? Foreign body removal. Can you remember which eye it was? Okay. Was it just a simple procedure? Scrape, removal and drops. Okay. Do you feel you fully recovered from that incident? Okay, thinking about your family, any diabetes there? That's fine. And do you drive? Have you driven today? That's good. The only reason I ask is because you can't drive after having these drops in. Not until the effects have worn off at least. More on that a little bit later. Now before instilling any eye drops, I need to do a few pre-checks. Alright, so let's get you in front of the vision chart. Okay, so we're going to begin by checking your vision. I would like you to cover your left eye with the palm of the hand. Look off into the distance at the chart there and just read the smallest row you can, please. Okay, cover the other eye and then read the rows from right to left as far down as you can, please. Okay, a couple more things to check before we dilate your pupils. It's always good practice to check the angle of the eye and check the intraocular pressure. So just looking off into the distance at the chart. Or straight if I block your view. Check of the pupils. And we'll bring the light from the side there. Where I can perform the shadow test. Excellent. Usually perform this in dimmer conditions. But we should be okay. The chances of a reaction to the drops is extremely low. We're going to pop some anesthetic into the eyes first. This is lidocaine fluorescein. It's going to sting a little bit. But it soon wears off. Okay, looking up to the ceiling, please. that in. Okay, so I'm going to check the intraocular pressures with the Perkins here. The sterile probe here gently touches the corneal surface for a few seconds. So I want you to keep looking straight ahead, or stare if I block the way. Okay. It's a nice reading there. And the left. Two readings of 14 mil of mercury, thank you. Right, the time has come to dilate the pupils. As I say, most people are fine after having tropicamide in the eyes. It's the 1% solution there. Now, if after having the drops when you leave you experience any headaches, eye pain, ocular redness, halos around lights or sickness feelings, that could be a reaction to the drops. It is extremely unlikely that that's going to happen. We'll give you an information leaflet about the drops afterwards. But we'd see you again if you experience those, alright? Come straight back. These drops are going to blur the vision for up to 6 to 8 hours. You're going to have 2 large pupils. They're going to be a bit sensitive to light afterwards with a bigger pupil, so sunglasses is advised. And as we discussed earlier, no driving until the drops have wore off. Alright? So looking up please. Shouldn't sting after having the lidocaine in. Good. How do you feel there? Excellent. So now that the drops are in, you're going to need about 20 to 30 minutes in the waiting area for the drops to work. Now, I'll come and check on you shortly. When they have worked, I'll call you through to the photography room to take your retinal images. Alright, so that's it. Go and have a seat in the waiting area. Okay, keep looking into the lens of the camera at the green light. I'm just going to focus it, and then there'll be a flash of light. Just get ready. There we go. And for the other eye, just keep looking at the light, please. Just focusing the image. And I'll take another picture. That's it. Keep focusing. Almost there. There we go. Thank you. Okay, so I've got your retinal images here on the system, ready to review. This is actually what the back of your right eye looks like. This is the disc-centered image. The disc is the optic nerve there. The area here is the macula. You can see it's a little bit more pigmented than the rest of the retina. I'm going to have a peek at the images, checking for any signs of diabetic retinopathy. Now, if we do see anything else that's not diabetic related, we will act accordingly. So let me start by just zooming in a little bit. Just paying close attention to the optic nerve here of the right eye. Excellent. Now, in the early stages of diabetic retinopathy, where you can see things like microaneurysms, dot hemorrhaging, blot hemorrhaging. So I'll be looking for all those things. Just checking the disc first. Now the vessels are well defined at the crossings. Certainly no evidence of any neovascularization, which is a very serious form of retinopathy. Okay, and I'm just going to review the nasal zone here. The superior portion. Excellent. I'm going down to the inferior part. Good. Now these arcuate yellow fibres are actually nerve fibres in the eye. It's quite normal to see nerve fibres like this. See how they come around like so and fan out. Excellent. And just checking the space between the disc and the macula there. Lovely. Now sometimes you may see things that look like microaneurysms when in fact they're actually just pigment spots. And speaking of pigment, there is a little bit there, an innocuous finding on the disc, 9 o'clock, close to the margin. But for this particular image, everything looks clear. Okay, the second shot of the right eye is the macular centered image of more area here that this covers. The retina does extend much further than what the photograph gives us, but we just work with what we've got. Let me just zoom in for you so you can see. So here is your macular area, your fine central part of the eye. Picks up fine detail. Just looking at the temporal area here. That's good. And certainly no macular edema. Just come back, just have a general look again. So I'm quite confident to say there's no diabetic retinopathy in the right eye or anything else unusual. Now for the left eye, you'll notice everything is essentially mirrored. So we'll start off with the disc centered shot of the left eye. Just have a little bit of flare here where the pupil maybe wasn't as big as could be, but the image is adequate enough to grade. Okay, now let me zoom in on your optic nerve. Excellent. You can see the little fine vessels there. No evidence of any new vessel growth. And the surrounding area. No microaneurysms or hemorrhages. Okay, we've got some nerve fibres here extending out. And this is the nasal portion. superior. And look at the inferior portion. Also the veins look good. No signs of any beading or loops. They are nice and clear at the crossings as well there. At the disc crossings. And you can see the optic cup there. A little depression in the disc. Look at this space here. Okay, and the macular shot, macular centered shot of the left. And the macula here. Looks clear of any issues. And we've got the extra extension here. Just the superior part. Let's go for the inferior part as well. Good, so I'm just scanning. Excellent. No signs of diabetic retinopathy in either eye or any other unusual ocular findings. Now these images will go off for grading. The results will come through the post within a week or two. I'm quite confident in saying that there's no retinopathy, so everything should come back fine in that letter. And we need to do this again in 1 year's time. You need to be screened every year. Alright? So when you get your invitation letter, book in with us and we'll arrange that for you. Alright, so I can let you go now. Looking good, thank you.